And as we saw with today's case numbers, the current trends are moving in the wrong direction. And that has the attention of the state's chief medical executive, Dr. Joneigh Khaldun. In a tweet posted Sunday afternoon, it reads in part, "Worked in ER last night, more COVID. Stark contrast to a month ago. Younger people can get sick and be hospitalized or spread to more vulnerable. Michigan, mask up, get tested, avoid indoor maskless venues. Get your COVID vaccine ASAP." That was the tweet. Now, Paula Tutman joins us live. And Paula, you spoke with Dr. Khaldun this afternoon about her concerns, and they are growing day by day.
Yeah, Karen, and rightfully so, because when you remember very carefully that Michigan was actually leading the nation in terms of keeping cases down, we are now the exact opposite. We are now on top of the leaderboard when we talk about this surge in cases. So I want you to think about an Olympic race, okay? So you have COVID-19 in one lane, and you have the vaccine in the other lane. And according to the Michigan's top doc, COVID is winning the race as of today.
Unfortunately, I think this virus is getting ahead of us because we've seen those cases increase. So I think we've made a lot of great progress with our vaccination efforts, but we're seeing these cases rise. We're seeing hospitalizations rise.
While the state has vaccinated north of 2.5 million Michiganders, more people need to step up and get vaccinated, and those who haven't yet must continue safe masking and distancing protocols, or COVID and its variant pals will completely win this race. Dr. Joneigh Khaldun is not only Michigan's top health advisor, but she's also a working emergency room physician. And during her weekend shift this last weekend, what she saw is deeply concerning.
We're seeing increasing cases, particularly among the younger age groups, 10 all the way up through even age 65. We're seeing more and more people coming in with symptoms. We're testing them and they're testing positive. And I think it's also important to note that it's not only the elderly who can get very sick. There are young people, and particularly younger people who may have underlying medical conditions, who are still getting sick from this terrible virus, and some of them need to be hospitalized. So it's really important that we all continue to remain vigilant in fighting this virus back.
These variants are also a concern because virus behavior is to figure out how to survive. And what the state wants to avoid with these younger infections is the variant figuring out that it can survive in younger patients and then morphing itself to do so.
Every time a virus is able to pass from person to person, that's another opportunity for it to mutate and get better. So it's important that we all, again, continue to wear our masks, wash our hands, socially distance, and of course, get a vaccine when an appointment becomes available to you.
Okay, so yeah, of course, we are more than a year in, and COVID fatigue is setting in. But COVID fatigue is a virus's best friend, because as we drop our guard, the virus is figuring out how to survive. And so that's why it is so important that we all do our part. Now, the rules are different for people who are completely inoculated. When I say completely inoculated, that means you've had both shots and you're past the 12 to 14-day gestation period for that inoculation or that vaccine to work. We do have a responsibility to others coming up at 5:30. I'm just going to try to narrow that down a little more, Karen, so we understand what we can do and what our responsibility is to others so that we can win this race ultimately.
All right. Thank you, Paula. Appreciate it.